antibiotics are given out like candy in this country, then they're not only given out by doctors like candy, and they're so overprescribed. And I've seen many medical journals say that 50% of them are really unnecessary. We're getting them in the food supply, as I mentioned. What role do antibiotics play on disrupting the gut?
Well, we have to remember that when you go to the doctor's office, it's not a prize to get a prescription. People think that to go to the doctor's office, they have to get a prescription. So here's a Z-Pack. Here's something. So you're going to get an antibiotic. And you're like, okay, well, this was a worthwhile visit. A prescription doesn't mean it's a worthwhile visit. So the problem with all the antibiotics in our system, one, we're creating resistance, which is very, very scary because that means the next time that you have something, it may not work because you actually do need it that time. Maybe you had a cough and they're like, oh, here, take something. It's a virus. Antibiotics don't work for virus. I have a lot of people who take antibiotics to try to prevent urinary tract infections. All you are doing is creating resistance when you do that. So what does it do to your body? Well, antibiotics are meant to wipe out bacteria. Take some good ones with it too. And we need the good bacteria. We are doing more and more research on good bacteria in the gut, our gut flora. We now realize that there is a huge, huge, huge connection between the gut and the brain, that helps with anxiety, it helps with preventing depression, it helps with Alzheimer's and dementia, not to mention helping just your GI tract normal so that you have a normal GI tract. So when we take those antibiotics and we get rid of that gut flora, we're causing a lot of issues down the road.
Yeah, that's really sad that, doctors, again, like you said, give antibiotics out for viral infections, and they do it oftentimes, and the patients just take them indiscriminately. So antibiotics disrupt the gut, and we know that, but the immune system, 70% of the immune system resides inside the gut. And
Mm-hmm.
so when we take these antibiotics without really questioning if there's a real need for them, we're over time, because we're losing the beneficial bacteria, we're really weakening our immune system, aren't we?
Yes, we are. Yes. And, as we get older, the one thing that we want to do is keep our immune system strong. So in our younger years, if we're constantly on antibiotics, and in our older years, we're constantly on antibiotics, we just keep decreasing our immune system. And that's what we don't want.
Yeah. Over the years, as I've seen, many patients are given antibiotics for, let's say, urinary tract infections or for sinus infections. They're giving them over and over, repeated. Kids that have ear infections, they're giving them one after another. And I've found that, one of the simplest way is to change the food that is on people's plates. And by getting out the foods that people are having reactions to that have immediate or delayed response allergies, that many times by just simply doing that, that the person will stop having these repeated infections. Have you experienced that at all?
Well, and I have clients. So when I start coaching my clients, I do virtual. So I have clients all over the world. We do kind of an elimination. So we eliminate gluten and dairy, first of all, for 6 weeks. Sometimes we bring it back in, sometimes we don't. What I find with a lot of my clients is those who have psoriasis, have allergies, have just any kind of rash, it all goes away,
Mhm.
which is pretty impressive. So yeah, so there's a correlation between gluten, there's a correlation between some fruits with some people and allergies. So it's a good idea if there's constantly having these infections to get tested. The other thing too is to look at, are you eating ultra processed foods? Because ultra processed foods are not helping your immune system one bit. If you're not giving your body the nutritional value it needs, it's not going to be a good, strong immune system.